AIM-listed Totally PLC delivers planned, urgent and insourcing healthcare across the UK and Ireland for the NHS and other organisations, other healthcare commissioners. It's recently published annual results showing a 25%, near 25% uplift in EBITDA on a 7.4% rise in revenue. The board have also been buying shares recently. One of the board members is the chief executive, Wendy Lawrence, who founded the company. Wendy, welcome. It's good to talk to you again. Thanks indeed for joining us. I want to go first of all, if I can, with your appraisal of where the company is after these full year earnings.
Okay, hi Jeremy. Yes, thanks for introducing us. I mean, we were really pleased with the results that we published for last year. It's been an unprecedented year, hasn't it, for business, never mind those that are involved in healthcare. And so it's very pleasing to put out results that show that, you know, every indicator that we've got is going in the right direction. And I think the way that our organisation performed during the last year has put us into a really, really firm, healthy position with our commissioners in the fact that we are reliable, we have stood shoulder to shoulder delivering care, and as a business, I've got a really strong foundation for moving forward.
I wanted to pick out one particular area of this, the urgent care revenue increasing by 9.2%. I know that you deal with the planned as well as the urgent care business. How is the business spread across planned, urgent care and insourcing?
Okay, urgent care is the biggest division that we've got. It's around 96% of our revenues. And as you can imagine, during the pandemic, the demand for access to urgent care was through the roof. So we provide 111 services, and we also are a private provider of urgent treatment centres across the country, and we're busy throughout the period and remain busy. In terms of planned care and insourcing, they are services of which you generally have an appointment for. And if you remember back during the pandemic, the majority of those services were paused whilst hospitals were responding to that urgent demand for care on the back of COVID-19. So you saw the higher growth in revenues in urgent care because a lot of the services in planned care and insourcing had to pause whilst we were dealing with COVID-19. They're all back working now, and so you can expect them to bounce back into the performances that we saw pre-pandemic. And of course, they're growing because we all know that the pause in activity resulted in massive growth in waiting lists. And I actually read in the Sunday paper yesterday that there's a prediction that the waiting lists in NHS England alone could go up to something like 14 million people, which is terrifying. But obviously, those other two divisions work with those people who are waiting for appointments. And so they're just as busy now as along with urgent care.
Back to urgent care specifically, I mentioned that because I wanted to put out this contract you've just recently established, a post-period contract, which you've announced recently. How important is this to you? I think it's worth about 4 million, isn't it, or something, £4 million?
Yeah, it's £4 million per annum, and it's at King's College, an urgent treatment centre. What's really important for us is that we continue to grow and show commissioners that actually the care that we deliver is absolutely high quality, relevant, and makes a difference to the way people can access care quickly. So what we saw during the pandemic is that the NHS and other organisations didn't put services out to tender. They were way too busy on, you know, just keeping up with the demands of COVID. And there have been 2 tenders published that were relevant for us since the sort of this calendar year, really, since things started to normalise. And it's really pleasing when we've actually secured both of them, the most recent one being King's. So it's really important for us and so important for the staff.
I mentioned that the urgent care revenue increased by 9.2%. Insourcing revenue, which you've already mentioned, increased by a whopping 202%. But I noticed that planned care revenue fell by 37.6%. Were you, obviously as the period went across, you were presumably aware of the fact that this was beginning to slow down. Is this an engineered slowdown on your part to try and focus on other more important and possibly more profitable areas? Or is this just because of what's been happening over the last year, this unprecedented year, as you call it, it means that there's been less planned care that's been delivered by the company?
Yeah, that's absolutely it. The whole of the elective, the planned care across the NHS was paused, and it was paused for 8 to 9 months. So we had our physiotherapists and our outpatient staff unable to deliver services because they were one-to-one face-to-face service, and none of those things could happen during the pandemic. So it was not orchestrated at all to focus on other things. We did redeploy the staff where we could, but we did have a number of staff furloughed during the period. As I say, they're all back working now and waiting lists are through the roof. However, during the period, it was a stop of planned care.
Yeah, let me just go to take a look at the share price, because when looking at this, I mean, we've spoken since the COVID lows, the vertical blue line we got on the chart here, when the shares were at the COVID lows around about 9.2 pence. We've seen something like around about a 300% increase in the share price. What is being priced in at these levels? I'm asking this because of the most recent contract, of course, we've got, plus the fact I know that clearly, whilst we are now beginning to live with COVID, that's not going away. How do you view where we are in terms of the healthcare in the country, but also more importantly, how Totally engages with the healthcare commissioners, as you call them?
Okay, so I think where we are with COVID right now, you're absolutely right. It's a case of learning to live with it, isn't it? It's not going to go away. This is a new disease that we now learn to live with. We hear all about the vaccination programme. We also hear about the different variants of the disease. And I think where we are now in the UK is a strong position of a good proportion of the population vaccinated, which is meaning that whilst we are still seeing the number of cases rising, hospitalisations are not going through the roof as they were before. And the whole reason that the system had to slow down in planned care was because hospitals hadn't got capacity to deal with planned care. So where we are right now is we will continue to see the variants, we will continue to see testing, and people will need to manage that. And organisations such as ours will be working with the NHS to ensure those people are supported, to ensure that they can recover quickly and get back to work, but at the same time reduce all of the waiting lists. So for us, it remains busy, but I think that is more now part of our business as usual, Jeremy, if I'm being very honest. And I think what we've got to do is continue to do what we've done throughout the period, deliver the high quality care, and making sure that when opportunities come our way to grow or to expand the services that we provide already, that we take those and demonstrate the resilience and the robustness of the models that we do.
And recently, as I said at the top, that we've seen some direct dealings in the company, been buying shares. I think many of the board members have bought shares. Interestingly, I mean, I'm talking to you now, shares are worth 37 pence. I think you bought these at 40, is that right? What does it demonstrate?
Well, I think that the whole reason that the board went with the share buy, we did it together. A few of us were talking about doing it. We thought it'd be more impactful to send out that message of our confidence in what we're doing. I think there is so much uncertainty in healthcare right now. When you look at businesses and how they've been impacted, you know, we're not unique, but there's not many businesses that have come out of the pandemic in such a healthy position as we have. And I think it's a show of our confidence that not only did we, you know, come out of the pandemic well, that we know that we can continue to grow, but also the board has the confidence that actually we will continue to do that going forward. And I think, you know, we haven't talked about insourcing much, but the whole insourcing model is about reducing waiting lists across hospitals, and our insourcing division is so busy. And so it is now important for us to continue to grow that, and you will see growth in that division way above what they did last year, because they are working now across the UK and Ireland.
Where do you think the business is going now, bearing in mind what you said about where we are and of course the big increase in insourcing that we've seen in terms of revenues? How do you see the business developing from here? What is your focus now for the company? Because we've seen you grow by both organic and also through acquisition in the past. I know you've bedded in Vocare very well. That's been a very positive contribution to the bottom line, I know, the last couple of years or so. Greenbrook as well. Do you think more acquisitions are coming? Is that what you're planning? Is that what you'd like to see, or do you see it growing by organic increments only?
Yeah, I think there's both, in all honesty, Jeremy. So I think there is a massive opportunity for us to grow organically, and we've talked about the waiting list position, and we've talked about the fact that the new business as usual is very busy for us with coronavirus. But I think as well there are new markets out there that we know that we can contribute to and benefit from, and some of those, you read about them every day. Lockdowns, the pandemic, the impact on people's well-being, the mental health, the support that people need to get back to work, as well as the other things that are now coming to bear, such as long COVID, and what are the impacts on people and the ability to work. So there, in my mind, there is opportunity for both. So organic, but there are some interesting acquisitions out there. Am I looking to add to, in a major way to what we already do? No, but there are things that are just a little bit outside the box for us that I think are really interesting for us and would allow us to, again, just escalate growth a little bit.
Okay, look, Wendy, we'll have to leave it there, but thanks indeed for joining us with an update of where the company is. It's been a pleasure to talk to you. Thanks indeed. Hopefully one day in the not too distant future, we'll be able to get together once again face to face for an interview in the studio. That'll be good when you're next in London. Thank you very much.
I do hope so, Jeremy. Take care.
Thank you very much indeed. That's Wendy Lawrence, Chief Executive of Totally PLC. For more videos from us here at IGTV, join us on Twitter at IGCom, Instagram, and subscribe to our YouTube channel.